There was a study published in Pediatrics that showed that parents who decided to delay or forego some vaccines were parents who made over $70,000 a year and had the most education. So why is it that the best educated parents who have the highest socioeconomic income are choosing to delay some vaccines? It's not because something is wrong with those parents, it's because something is wrong with the current CDC vaccine schedule. I'll tell you an industry kept secret, which is that a lot of doctors in America are choosing not to vaccinate their children on the current CDC schedule. Almost every doctor I've interviewed has chosen an alternative schedule for their children that is based on better health and better science. It's a really well-kept secret that the people working at the CDC are also alternating the vaccine schedule for their own children. How do I know that? I know that because I talked to them. So I had someone who's an active, very, very vocal spokesperson for the current vaccine schedule who confided in me that that person did not do the hepatitis B vaccine because when that person looked at all of the data, that person realized that it wasn't a good idea. So here we have public health officials screaming from the rooftops that parents must do this vaccine schedule exactly as it is put out by the CDC, while themselves and their own families are choosing not to follow it. Whenever I have a doctor who I talk to who says I alternate the schedule, I say, would you share that? Can I use your name? And they say, I don't want to lose my job. Or I don't want people to know, or I'm choosing not to do these vaccines because I know they're not effective or I know they're not necessary, but you can't let anybody know. And I'm a journalist and I'm bound to journalistic ethics and I could never reveal who those people are, but I can tell you that I have spoken to them myself and they have told me the truth. And the truth is that they are alternating the schedule in their own families for their own children.
Why would CDC employees not follow their own vaccine schedule?